Hello, everybody. Good afternoon. Thanks for being here. Thursday. Happy to report no deaths over the last 24 hours. We've lost 194 of our neighbors over the course of this pandemic since March 16th. Certainly, that's good news. Looking at tests, we've had over 1,900 tests in Onondaga County alone over the last 24 hours. Our mandate as a region is 775 per day. As a region, we're closer to 3,000 tests on the day. So good day of testing for Onondaga County and all our partner counties as well in central New York. Testing, we've been bringing on some new partners. I know there's a couple labs now running out of the Syracuse Community Health Center. We anticipate that to help with some turn times. In addition to that, we've been working on new lab partners that we'll be working with directly, and we've been procuring test kits with a different partner that does like a mail-in testing where you can do that. We're going to be procuring test kits there, and we've helped some of our college partners procure some of these test kits. It's 24 to 36-hour turn time. So we're beefing up. We're getting ready for more students to come back. We're getting ready for more people to go back to work related to school for high school and elementary school and middle school. And we're preparing for the flu season as well. So this is something that we're going to be beefing up our testing infrastructure in a very robust way moving forward. Looking at hospitalizations, down 41 individuals in the hospital, down 4 from yesterday. Good news. 21 out of the 41 are from the memory care facility that we've been talking about. 17 out of the 41 are ready to go home to a nursing or assisted living facility as soon as they pass with a positive COVID test. Remember, this is an executive order. These individuals right now are healthy enough to leave the hospital, but until they test negative for COVID, that's where they will stay. ICU, still 6 individuals in the ICU. That's the same as yesterday. When we look at the hospitalization numbers, out of the 41, 32 are Caucasian, 4 are African American, 2 are of another race, and 3 have not shared their demographic information with us. Overall, 3,218 positive cases since March 16th. That's up 17 since yesterday. Out of our 17 new cases, 3 are household contacts of previously confirmed cases. 3 are new cases related to senior living facilities, 2 residents, 1 staff member. 4 are still being investigated at this time, contact traced. 7 are community transmission, of which 3 are unknown. 4 of them are known sources of community transmission. And we had 5 cases out of the 17 that were already in a quarantine. That's always helpful because that helps with our contact tracing. Presently, we have 255 active cases. This is very good news. If you look here, I believe it's our yellow, yes, our yellow line represents active cases. Certainly, we have total cases, recoveries, and then below the active cases, we have deaths. So certainly, when you look at our active cases, the best we've been in a long period of time. Again, what makes an active case a recovery is 10 days, essentially no symptoms if you have COVID, 14 days if you're over 65 years old. And how do you get to the point where your active cases are going down? Very simple. You don't have as many new cases, and you give time for the medical professionals to get people recovered. When you look at the active cases, how far have we come? 255 now represents 8% of our total cases that we've had. At one point, our caseload was as high as 920. At that point, that represented 43% of our cases. So it shows you really how well we are doing now with the virus, and that's really a tribute to the community. let's see here, recovery is now up to 2,774. When we look at our cases, 1,883 female, 1,333 male, 229 under 19, 596 in their 20s, 442 in their 30s, 389 in their 40s, 480 in their 50s, 384 in their 60s, 285 in their 70s, 255 in their 80s, and 158 in their 90s. When you look at the story behind what we're seeing, very much like when we first saw COVID. You have younger people socializing. That's how this has been spreading. We did not have, right now we're not seeing, outside of the one cluster at the memory care facility, we're not seeing the senior-driven data, which is good. That's helped our numbers get down. What are we doing now differently than what we were doing in the beginning of this process? We're testing universally. We have infrastructure, so we have an idea of what the real infection rate of the community is, which it is 1%, both for the Central New York region and 1% for the county on a 7-day average. So we've come a long way, but for our young people, just recognize that there's risk. There's risk in being social, and that's certainly what's been driving our cases, even though this week our caseloads are certainly down and on pace, knock on wood, to be at the lowest level that we've seen in some period of time. Travelers related to quarantine, I'll address a question that we are getting a lot of. Per the governor's order, if you're returning from one of the hotspot states, you must quarantine for 2 weeks upon your arrival in New York. Does getting a test substitute for being in a quarantine? No, it does not. If you can get a test, that's nice, but you're in a quarantine because the incubation period could be up to 14 days. Hypothetically, you could test negative in day 7 during the quarantine, and on day 13 or 14 test positive. So there are different rules if you're considered an essential employee, and there's guidance for that. And if you are dropping a child off at college, this has been another one we've received. If you are driving into a hotspot for a day, you're driving in, dropping your child off at college, coming back that same day, you do not need a quarantine. If you spend the night, you do. Those are some of the questions that we're receiving a lot about. We've had some good conversations with the school district superintendents related to going back to school. Certainly, I think there's consensus around if a parent is able to do distance learning with their child, and that's what they want to do, that those will be options available. We've received a list of just concerns related to things that the district wants to see addressed, and I say the district, all of our districts. And so we're trying to work with the state on their behalf so that all their questions are answered and so that they can come up with solidified plans for going back to school. Remember, August 1st, if you're under 5% of an infection rate, you go back to school. And at any point, if the infection rate gets to 9%, school is paused. We're at 1% on July 23rd. For us to be at 5% within 8 days on a 7-day average, things need to get really scary really quick. So we'll be under 5% on August 1st. Saying that we're under a lot of pressure right now. In Washington, D.C., the Senate and the House are really debating and negotiating the futures of individuals in our community as we speak. So the reality is the Senate bill is not going to have funding for local governments. The House bill did. Eventually the Senate bill will probably get enough votes to pass, and the fate of our budgets here locally will be dealt with in conference committee. This is a ridiculous position that we're in, but it is what it is. We'll be prepared to make appropriate decisions shortly thereafter. We know what is done in Washington, D.C., and we'll see what that means. Saying that, happy to take questions.
local funding is, I mean, if the Democrats had it, there needs to be some sort of negotiations between the Democrat-led House and the Republican-led Senate. Are you not hopeful it will make it through at all? Are you still hopeful? What's your read on it now?
Well, I think the fact that most likely out of one house something will pass without it in it is not good. You're dealing with three different bodies at the negotiating table. You have the president. I think the president's position has been interested in checks going out to residents. I think there's been some level of unemployment insurance enhancements will continue, not at what the levels they are today. I think there's back-to-school funding for school districts that the Senate Republicans seem to be very interested in, liability protections for businesses as well. And then the House had other priorities, some of them the same but different. We certainly did well in the House bill. We never anticipated we would do that well in the final result. So our hope is that the House will stay firm for help for state and local governments, and that even though I don't like it, but that we're being used as a bargaining chip. The Senate knows that the House wants us to get help, and they're going to make the House buy back funding for local and state governments. This is how the process usually works. But I don't like being a bargaining chip when we're talking about people's lives in the middle of a pandemic, and certainly with high unemployment. High unemployment drives anxiety, which changes human behavior, which means that the services that we do, taking care of our communities vulnerable, are enhanced. And when we say the community is vulnerable, that's not just our seniors or our young people or our poor people. During a pandemic, that's all people. So again, this is something that we've been told all year. We're going to get to state and local governments. We understand you're big employers. We're going to get there. We're going to get there. We've waited, and now for us to kind of be taken off the table in negotiations, just not the responsible thing to do.
As far as testing goes, I know that it's taking at least 7 days now, sometimes 10 days.
For some.
For some,
yep.
Right. And even when you go through the testing site, they say 5 to 7 days. So, I mean, with that, I know we have rapid testing coming. What's the progress on that?
Yeah, so there's rapid testing here now, but there's capacity constraints. So for folks who are going to testing sites or their doctor's offices, and their partner, their lab partner, is a national lab, they're going to be looking at these 5 to 7 business days, and that's what they mean. They don't mean days, they mean business days. So that could be a period of 10 days or 11 days total. If you are going because you're in a procedure or you're going to one of the hospitals and they deem you to get tested, they are often using some of their rapid technology, or if it's going to the Wadsworth lab that some of the hospitals have partners with, those test times come back faster. So if you're using a national lab partner, the chances are your testing has been delayed. So what are we doing to try to alleviate that? The Syracuse Community Health Center, which has been our primary testing partner, uses national partners. We've teamed them up, and I believe, Dan, on Wednesday they started using that. Is that the day? Yes. On Wednesday, we brought on another lab that their testing turn times, so they now have 2 labs they're using. They're not just using 1, they're using 2. Their turn times are supposed to be 3 to 5 days, not 5 to 7. So in addition to that, we've bought our own rapid testing machine where you can do up to 100 tests a day, and we feel like we may have another rapid testing machine that we get our hands on, which even allows you to do more per day. Now we then have to team up with labs still. We don't have our own lab, so we're working through what labs we can have using these machines so we get those turn times up. So overall, Upstate is going to be getting the Roche machine in the next few weeks. The Roche machine will allow 3,000 tests a day. I referenced this other testing partner that their model is different. You can order a test, you pay for it, right, and $100 I think it is, or $125 with shipping, It comes to your house. You can give it to yourself, put it back in 24 hours. As soon as they get it, they process it. We have worked with some of our colleges, and they have bought a lot of those tests so they can get those out to their students. And then the test results will go directly to the university and our health department, and we'll know who is negative coming into the community, and then they'll get tested again. So we've brought on all these partners in the last week. So overall, we think on average testing turn times, as soon as this is all up and running, will be very, very quick, probably the quickest they've been.
When someone is tested and it comes back 7 to 10 days later, are they still required to do 14 days, even though it's...
No. So this is how that would work. If you were symptomatic and you go and get a test and you get it back 7 days later and it's positive, you were symptomatic, so you're in a quarantine anyways, right? You're under the assumption you have COVID-19. You have symptoms. That's the law. Now what will happen is they'll say, talk to us about, with our health department, when did you stop seeing symptoms? 2 days ago I stopped seeing symptoms. Okay. From that point on, they then look to make sure that you have 3 days of no symptoms, then 3 days of no temperature, and then after 10 days, you can be, and that 5 or 7 days counts towards that if you didn't have symptoms during that. And then after the 10-day number gets there, if you're a certain age, you're then released from quarantine. And if you are asymptomatic, you're not in a quarantine. And so if you get called 7 days later asymptomatic, but you're positive asymptomatic, that's when your process starts right then. Yeah, it's tough because this is a crisis that's not ours, right? So the national labs, I think the governor talked about this earlier, and the governor was right. When states don't have their own labs and all of their testing is reliant on national labs, that puts a strain in the whole system. And many of these doctors' offices that weren't doing testing at the beginning have picked up testing, but they team up with the labs. So that's the challenge. And so we have new partners on where it will get a little bit better. But once the full rapid testing is up and running in August, it's how do we use it, and how do we, where do people go, and then it will be very, very fast.
Can I ask a couple more details about that? What did you say the county has purchased a rapid testing
Correct.
machine? From what machine?
Ronix.
What is it?
Ronix.
Ronix?
Yep.
And that'll be used where?
We haven't decided yet, but we'll be using it probably to deal with symptomatic folks at first. We may end up using our rapid testing machines as ways to hopefully open our economy as well.
And that can do 100 a day.
100 a day.
And how much did that cost?
$50,000.
And then the health center has a second national lab now that they're working with
Correct.
In addition to Quest?
I don't know if national or regional maybe. I'm not sure if it's
Is
national.
it GenetWorks? They
No.
had
Aegis.
Aegis. What
Yep.
happened to GenetWorks?
I don't know. I don't know what happened with them.
And then upstate, can you talk a little bit more about what their capacity will be when they get the Roche machines?
They have a lot of capacity now, but mind you, the hospitals are dealing with their patients who are there, and then they're also dealing with elective surgeries that have to test and have those results back within 72 hours. But a Roche machine is 3,000 additional tests per day.
Okay, and then the fourth piece of this is the colleges are buying a
Yes.
self-testing system, is that
We'll
right?
probably buy some of those as well. And so that's another testing outfit that we have teamed up with NISAC, Association of Counties. That is a different model. They don't typically bill insurance for that. You basically pay for your test. The universities are buying a lot of these tests, so I don't know if they will charge back the students or not. That's their call. But those turn times are 24 to 48 hours once it gets to their lab. How do they do that? They control the whole supply chain. They own their own supply chain, so that's how they do it.
What company is that?
I would have to get it to you. It's very similar to Test Kit, so the name of the company. But that's one that is a partner with our State Association of Counties that we've brought online as well. There is usually a preference with symptomatic folks, even when you get tested. And that's something that even at the national labs, they've been working with the CDC, and the CDC is giving preference there. If you're asymptomatic, you're much more likely to probably fall into the category if you go to a national lab that it's going to take you longer.
Is that mailed kit, is that going to be the main way you think that the colleges test students?
That will be the first wave, as SU and others are confirming that the students actually are negative. And then when they come back onto campus, they're going to test them again.
Just some of the deficit information. You've requested like 40 million is a support that you'd like from the federal government.
Look, we'd like more than that.
Sure, but is it 100 million that you're looking to make up ground for?
We have had to do things that we wouldn't have had to do if there wasn't the 100-year pandemic. So we essentially are looking at a $100 million impact. And so that is based off of costs, that is based off of lost revenues. And when you look at how do you make it up, and again, what we don't know, we had a call, myself, County Executive Steve Ballone of Suffolk County, and County Executive Steve Newhouse of Orange County today, bipartisan group of county executives, talking about this. What we don't know is what's going to happen in the fall. We went through this exercise and dealt with COVID in the last 2 weeks of flu season. 2 weeks, not 3 months. So we don't know what's going to happen related to our economy. We don't know what's going to happen related to increased costs with COVID because of you're going to have to rule out so many people who are sick with something other than COVID. Right now, if you're symptomatic or you got allergies, we're going to almost assume you got COVID even if you don't, and start the process there. Or are we saying go get tested assuming you have COVID? There's not that many symptomatic, comparatively speaking, to where you are during the middle of flu season when you got a cold. So there's so many variables, but we know we're going to lose revenue between $40 to $65 million from sales tax. We know our room tax, we're going to lose $5 million. We know that when you look at property tax collections, because we hold all the other municipalities harmless, we write them a check, we have to go chase down all that money. We don't know how bad that's going to be because you have high unemployment. Then when you look at our increased costs, with that, you're right around $100 million. We've made lots of cuts in our budgets, but because courts were shut down, we are responsible for our communities vulnerable, our children, for foster care. We can't get relatives of children who need to go into foster care qualified in our kin care program. So what do? We have to do more expensive alternatives that aren't the best for the child. That all costs money. So even though we cut $30 million basically of any sort of discretionary funding and things that weren't discretionary, we still have huge increases in other areas, all driven by the COVID pandemic.
At what point do you give up hope relying on Washington and sit down and hammer out a cost-cutting plan locally?
Well, we've already done it. I mean, if you look at it, we know there's no more cost-cutting. There's reorganization. So the cost-cutting's done. There's nowhere else to cut. So it's very simple. There will be reorganization in August of county government for the end of the year and potentially into 2021 if we don't get help.
Is the amphitheater bleeding losses, and how much?
I don't think they're bleeding anything really because there's nothing going on there. You might have some losses just from accounting of people are still mowing the lawns, and so that gets booked somewhere. People's time gets booked even if they're county employees, but there's no real hard cost because we haven't had events. So usually you put on one show or 20 shows, there's a lot of hard costs that go up front. So certainly if everything changed and we could have one show up there, we might make the business decision that you can't have one show because it will cost too much money to have one show.
What happened to Parks Commissioner Bill Langley, and who's the new commissioner?
We don't. Commissioner Langley's working in a different department, and in our facilities, we're very happy to have him there, and you know, we're interviewing candidates for that. So just remember, I took over a 4-year term, and I was there for a year before that. But just like we have with other employees, folks are getting opportunities to work in different departments they've always wanted to, or there's other opportunities, you know, that we're looking to build a broad-based administration.
Will that save the county money at all, as you're looking at?
No. We're holding, right now we're holding 400 plus positions already. So think about that. There's over 260 full-time positions that every other year I would have filled right now that we aren't holding. And then there's another 200 part-time that we use in the summer times as seasonal help that aren't filled. So before we even talk about what reorganization looks like, we're already, you know, 15% of our workforce has already been impacted.
What real effects would people notice from those kind of jobs sitting empty?
Well, real effects is I think some of the impacts for what's already sitting there are limited because people's behavior has changed so much, so expectations are more reasonable, I think, in the community when it comes to things. But certainly, if we have to do another reorganization in August, people will see drastic things. It's not even, this is no joke. There's nowhere left that you won't be hurting people and make our job to do what our basic services are, to do them well.
And how does half of Washington not understand that?
I don't know. I don't know if it's half. I think, you know, probably a quarter.
Still, the quarter that matters, apparently.
Yeah.
Those travel rules you mentioned from states with outbreaks, are those details of those are all state regulations, and are those on a state website?
Yeah, I would. Yes, I believe that there's guidance that we've seen, but I'm assuming state DOH has those up as well. Yeah, if that's one of the challenges that you have. So certainly your contact tracing, when you have backed up test times, if someone who's showing no symptoms is going to start when that happens, if you're symptomatic, you're essentially contact tracing is a little bit easier because you're supposed to be home. And so at least from the period of infection moving forward, the number of contacts should be 0. Whereas you then do the contact tracing for the 2 days before symptoms. So that's one of the challenges when you have, you know, other states haven't built up capacity for labs, and everybody relies on 9 or 10 national labs to do all the testing. This is what happens. So we're lucky that we've had options, and we've been nimble for the most part, and that will be, when we need the testing the most, really going into the fall and going into this period of time with students, we've been able to work around the existing national backlog.
Do you have an update on the testing of the county jail inmates?
We've tested inmates. I know there were some positives. I saw on a news outlet that they reported. I did not know that. I don't know. How many positives do we have? 2? 2 inmates tested positive.
And that was a general universal test among inmates?
What do you mean by general universal tests?
As opposed to just testing the incoming inmates?
I believe there are incoming inmates that tested positive, is my understanding.
Did you ever do the universal test?
I believe, Tim, with the way that at the Justice Center, I would have to find out how many, but there's often quite a bit of flow going in and out of the Justice Center with the new the new laws, so it's not really a holding center, but can we get Tim those numbers on how many people have been tested from the sheriff? I think it's a risk. I think there's asymptomatic folks that have had this virus. I don't think science knows enough about if you're asymptomatic, if you are less infectious. Certainly, I think part of why infection rates are what they are in other parts of the state is because you have either no symptoms or light symptoms in young people, so they continue on with active social lives, and next thing you know, it goes on to another person, and then they have no symptoms or light symptoms, and it goes on to another. So we know that asymptomatic folks can pass the virus on. Whether or not they're as infectious as somebody who's visibly sick and coughing all over, I'm not sure yet. But certainly in a perfect world, we have somebody who wants a test come up, they get a test. Within 4 hours, they know the results. Nobody's there yet. I think our state's probably closer than other states to being there.
Today's opening day, and the Blue Jays are looking for somewhere to play. Have you had any conversations about them using NBT Bank Stadium, or what are your thoughts on that?
Yeah, we have, and so not directly. We've talked to the Mets ownership about it. I don't know what's going to happen. There are a couple things that make our facility appealing from logistically not too far away from Toronto. We have new lights that meet Major League Baseball standards. And certainly we have an airport and when you look at the way the league's set up, I think we could be a home if they chose. I'm not sure. There has not been, to my knowledge, serious conversations, but we would be open to that. I know they've had conversations with Buffalo, and they've had, I think their preference is to be in Pittsburgh, but I don't know where that's going to land.
Were the Mets parent organization supportive of that option?
I don't think they were adversarial to the idea at all. So, and they would be the ones that these owners know each other, right? So, our tenants, the Mets, and so if the Mets are okay with it and they think it's a good idea, they'll probably help facilitate those conversations. I said I'm okay with having those, is my position.
Would you ask for them to come here? Like, do you?
We would love to host them. We would love to host them. I don't know if that is a 5% chance or a 1% chance, 10%. I couldn't handicap that, so I don't want to get the community too excited, but certainly we would love to host Toronto and help them out in their time of need. Any other questions? Okay. Well, let's please have a good weekend. I know that Walton Street's going to be open again for some outdoor dining, and so please support your local restaurants, but support them in a smart way. Get dinner, not just drinks, and please be safe. We're making a lot of progress right now. Our data continues to go in the right direction, and this is where we need to be as we go into the fall and the winter time. We need to be in a very strong position with this virus. So thank you and be safe.